Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Mercury. Metallic mercury is non-poisonous. Mechanism of action. Action of mercury is similar to that of arsenic, where mercury also inhibits sulfhydryl group of mitochondrial enzymes. Acute mercury poisoning contains 3 Gs: glossitis, gingivitis, and grayish-white coating of the tongue. Acute mercury poisoning has burning and metallic sensation or metallic taste over the mouth, throat, and entire abdomen. Treatment of acute mercury poisoning. British anti-levisite is the agent of choice for acute mercury poisoning.
thank you and thank you for watching.